Hey everyone, welcome to another episode of the Mind Your Health podcast. I'm Dr. Connie. So, for those of you who don't know, I've been a women's health focused pelvic floor physical therapist for over 2 decades. So, today is a particular topic that may ring true for so many of you. We'll dive into the pelvic floor health, discussing the three most common pelvic floor dysfunctions, their causes, exacerbations, and how you can fix and prevent them. But also, the pelvic floor is an integral part of our gut health as well. And I hope you begin to see how our body is designed to work harmoniously together and find motivation to take care of your pelvic floor health. So pelvic floor issues affect millions of people worldwide, but they're often misunderstood or overlooked. So grab a cup of tea, get comfortable, and let's explore this important aspect of our health. So let me give you a little bit of an overview of the pelvic floor dysfunctions. The pelvic floor is a complex network of muscles, ligaments, and connective tissue that form a supportive sling at the base of the pelvis. And these muscles span from the pubic bone at the front of the body to the tailbone at the back, and from one side of the pelvic bone to the other. So front and back, left and right. And the main functions of the pelvic floor muscles include supporting pelvic floor or pelvic organs like bladder, uterus in women, and rectum, and helping them maintain their proper position and function because that's super important. It also helps to control your bowel movements and bladder function. These muscles control urine and feces by contracting and relaxing to open and close the urethra and the anal canal. It also aids in sexual function. The pelvic floor muscles contribute to sexual pleasure and arousal in both men and women. In men, these muscles help with erectile function and ejaculation, while in women, they're involved in sensation and orgasm. It also helps with stability as well as posture. The pelvic floor works with the abdominal and back muscles to provide stability and maintain proper posture. So, what are the three most common pelvic floor dysfunctions? Number one is pelvic organ prolapse. Pelvic organ prolapse occurs when the pelvic floor muscles and connective tissues weaken or become damaged, causing one or more pelvic organs like your uterus, bladder, and rectum to descend and press against the vaginal or rectal walls. It can be very uncomfortable. It can cause pressure and urinary or fecal incontinence, and even sexual dysfunction. Second most common is urinary incontinence. Urinary incontinence refers to the involuntary leakage of urine. There may be several types of urinary incontinence I'll go over, including stress, as well as urge incontinence, and there can be a mixed incontinence as well. Third most common is pelvic pain. Various factors like muscular imbalances and nerve irritation and infections can cause pelvic pain. And this pain can be chronic or intermittent, and it can be so life-stopping because it can be so painful. And a lot of women, especially women, they don't know where to go to seek help for this issue. So let's go further into each of these issues and just talk about how it can be worsened and what you can do to prevent or get treatment for it. Number one is pelvic organ prolapse. So pelvic organ prolapse is when the pelvic floor muscles and connective tissues weaken or become damaged, causing one or more pelvic organs like the uterus, bladder, or the rectum to descend and press against the vaginal or rectal walls. This can result in a sensation of pressure or fullness of the pelvic area. It can cause discomfort, difficulty with bowel and bladder function, and sexual dysfunction. And there are several types of pelvic organ prolapse, including cystocele, which is the prolapse of the bladder into the vagina, uterine prolapse, which is the prolapse of the uterus into the vagina. And then there's the rectocele, which is the prolapse of the rectum into the vagina. And then there's the enterocele, which is a prolapse of the small intestine into the vagina. Remember how I kind of alluded to the fact that prolapse or pelvic floor dysfunctions altogether can affect your bowel function? Well, this is what I mean, right? So what are the causes of this? Well, number one is childbirth. Vaginal delivery can cause significant strain on the pelvic floor muscles and connective tissues, increasing the risk of this prolapse because of that laxity and pressure. The risk is even higher with multiple pregnancies or prolonged laborious labor. Second is just aging and menopause. As women age, estrogen levels decrease, weakening the pelvic floor muscles and connective tissues. This can increase the likelihood of developing a prolapse. Third is obesity. Excess body weight puts additional pressure on the pelvic floor muscles, which can contribute to developing pelvic organ prolapse, as well as sedentary lifestyle. We're seated a lot, right? And so that can cause that pressure as well. And then there's chronic constipation. How many of us are constipated? Well, regular straining during bowel movements can weaken the pelvic floor muscles over time, increasing the risk of prolapse. It can also be worsened by the following: heavy lifting. Those of you who enjoy HIIT exercises or boot campy type exercises that cause Valsalva maneuvers, lifting heavy objects or engaging in activities that increase abdominal pressure can further weaken the pelvic floor muscles and really worsen the prolapse symptoms, okay? And then second is the high impact exercises. High impact exercises like running or jumping can put additional stress on the pelvic floor, worsening the prolapse symptoms. And then lastly is the straining during bowel movements. Consistency or consistently straining during bowel movements further weaken the pelvic floor muscles and aggravate the prolapse, because the lower you go, the more pressure you put to kind of putting the feces out, it also allows the prolapse to worsen down into the vaginal canal for those of you who are women. So what do you do, right? We've all heard of do the Kegel exercises. Regularly practicing can help strengthen the pelvic floor muscles, preventing or improving prolapse symptoms. Kegel exercises is a simple exercise. All you do is just pull up the anus, or like you're trying to, you have this uncontrollable urge. Your bladder's full, but you can't go to the bathroom. So you have to sort of tighten up there. And that's what I'm talking about with the Kegel exercises. And it's something many of you kind of don't even know that you're doing. As a women's health physical therapist, I've had to examine a lot of pelvic floors. And what I've come to find out is that a lot of women who think they're doing Kegels, they're doing the opposite to pulling up and in. They're pushing out because they don't know the difference between puckering up and in or pushing out and making the prolapse worse. So it's sort of important. So you might want to, which leads me, the second option is pelvic floor physical therapy. A physical therapist specializing in pelvic floor rehabilitation can develop an individualized exercise program to make sure that you're doing the right thing and target and strengthen weak muscles. I also have a YouTube channel. We'll link it here to make sure you know that you can do these exercises, and maybe you can incorporate this into your daily routine, or at least until you get the hang of doing the Kegels properly. Third is lifestyle changes. Adopting healthier habits like weight management, Avoid heavy lifting and managing constipation can help prevent or reduce the progression of pelvic organ prolapse. Okay. And then lastly, I've treated women with the prolapse so bad that the inside of themselves, like the enterocele or cystocele or rectocele, has gotten so bad that things fall out of their vaginal area. And oftentimes it gets so bad that the outer layers of that, inner layer, what's supposed to be inside of them, become crusty and dry, which is not a good sight to see. And it's very embarrassing for them as well. So there's surgical intervention where in severe cases where conservative treatments are ineffective. And that's why I promote the prevention. And I'm having this podcast topic so that most of you, if it's becoming a small problem now, it can be a big issue later. Do something while you can is really what I want to recommend. Because surgery may be recommended to repair the prolapsed organ. And I've had a lot of women get this done. It can cause secondary issues in the SI and chronic low back pain, as well as you might have to go back and do it again because it becomes ineffective over time. You do also have to incorporate, even though you get surgery, to do the lifestyle management of doing all the things, because just because you're tucked and, surgically fixed, it's not a for sure thing, because you have to remember you have a mesh placement. Sometimes it involves hysterectomy, which I don't recommend unless you absolutely need it. And I just want to make sure that it's not a permanent solution either. You do have to start to work on your weight control as well, because it can worsen the damage. And then you have to go back again for surgical intervention. Okay. Second most common is urinary incontinence. Urinary incontinence is the involuntary leakage of urine, ranging from small trickle to a complete loss of bladder control. This condition affects millions of people worldwide and can significantly impact an individual's quality of life, confidence, causing embarrassment, social isolation, and limitations in daily activities. There are 3 types of incontinence. There's stress incontinence, urge incontinence, and mixed incontinence, like I mentioned. Stress incontinence occurs when urine leaks during activities that increase abdominal pressure, such as coughing, sneezing, laughing, or exercising. And it often is caused by weak pelvic floor muscles, which cannot effectively support the bladder and urethra. Second is urge incontinence, also known as overactive bladder. Urge incontinence is characterized by sudden, intense urge to urinate, followed by involuntary urine leakage. And this involuntary contraction of the bladder muscles cause this type of incontinence. Third is mixed incontinence. This is a combination of stress and urge incontinence, with individuals experiencing symptoms of both types. The causes can be the following. Number 1, weak pelvic floor muscles. Weakened or damaged pelvic floor muscles can result in insufficient support of the bladder and the urethra, leading to urine leakage. Second is overactive bladder muscles. This is involuntary contractions of the bladder. It's neurological in nature, which can cause sudden urges to urinate and subsequent leakage as well. It can be due to certain medical conditions like diabetes, neurological disorders like Parkinson's disease, multiple sclerosis, and pelvic surgeries can contribute to developing urinary incontinence. It can be worsened by caffeine and alcohol intake. Both caffeine and alcohol can irritate the bladder and increase the risk of urinary incontinence. It can be worsened by certain medications. Some medications, including diuretics, antihistamines, and certain blood pressure medications, can exacerbate incontinence symptoms. Third is urinary tract infections. Infections in the urinary tract can cause irritation and inflammation, leading to increased urinary urgency and frequency and incontinence. So how do you prevent or treat it? Bladder training. This technique involves scheduling bathroom visits at a regular interval and gradually increasing the time between visits to retrain the bladder to hold more urine. Second is pelvic floor exercises. Again, my YouTube channel is linked below. I'll make sure that you have that link to my pelvic floor exercises. Regularly practicing Kegel exercises can help strengthen the pelvic floor muscles, improving bladder control and reducing incontinence symptoms. Third is medications. Depending on the type of incontinence, medications like anticholinergics for urge incontinence or alpha blockers for stress incontinence in men can be prescribed to help manage symptoms. But again, I don't recommend medication route because there's secondary effects to the medications as well. Lastly is surgery. In severe cases or when conservative treatments are ineffective, surgery may be recommended to improve bladder control. Surgical options include sling procedures, bladder neck suspension, and artificial urinary sphincters. The choice of surgery depends on the type and severity of incontinence, the patient's age, and overall health. Okay. The third most common type of pelvic floor issue is pelvic pain. Pelvic pain refers to discomfort or pain experienced in the lower abdomen or pelvis. This pain can be chronic, lasting 6 months or more, or acute, short term. Okay, it may range from mild to severe. Pelvic pain can occur in both men and women, although it is much more common in women. It may be associated with specific activities like sitting, standing, or engaging in sexual intercourse, or it can be constant, which can be just debilitating. Causes can be muscular imbalance. Dysfunction or imbalance in the pelvic floor muscles can lead to pain in the pelvic region. And this may result in the muscular weakness and tightness or spasms that occur regularly. And I just have to tell you that it can be from scarring. Like your body has a natural tendency to scar the myofascial tissue. And when that happens, in and around the uterine tissue or in your, pelvic area, that can cause a lot of pain as well. Nerve irritation or damage can also cause it. Nerves in the pelvic region can become so irritated or damaged due to injury, surgery, or other factors leading to chronic pelvic pain. It can be due to infections or inflammation. Infections or inflammatory conditions like pelvic inflammatory disease, endometriosis, or interstitial cystitis can all cause pelvic pain. And this is a topic that needs so much more explanation. Please comment below if you'd like me to do a podcast dedicated to this, because this also goes hand in hand with your gut function as well. Another thing is psychological factors, you guys. Stress, anxiety, and other emotional factors can contribute to the development or exacerbation of pelvic pain. Hence the term, somatic psychological factors, right? Because psychological factors, the emotional triggers that end up being somatic in nature, which is your body. So some of the things that can worsen this is sitting or standing for long periods of time. Prolonged sitting or standing can put additional pressure on the pelvic floor muscles and nerves, potentially worsening pelvic pain. Second is high stress situations. Stressful situation can exacerbate pain by causing muscle tension, including the pelvic floor muscles, and that can cause so much pain there as well. Sometimes it's just menstruation or sexual activity. Hormonal fluctuations during menstruation or physical active sexual activity can sometimes trigger and worsen pelvic pain. So, what are the prevention and treatments for this? Well, again, physical therapy and pelvic floor relaxation techniques is quite effective. I've been doing it for over 2 decades. I love doing this because a physical therapist specializing in pelvic health can help you identify and address the specific muscles and imbalances, as well as to teach you relaxation techniques to reduce that pain and improve function, all without medications, right? But second is the medications, because sometimes I've seen patients like it really gets to your head when the pain is so severe. So depending on the underlying cause of your pelvic pain, medications like anti-inflammatory drugs or muscle relaxants may be prescribed just so you can, live your day to day to help alleviate pain and inflammation as well. Third most powerful is mindful practice. Practices like yoga, meditation can help significantly reduce stress and promote relaxation, which in turn may help to decrease that pelvic pain. How that works is the nervous system regulation from, just spasmodic to complete relaxation, and allowing muscles and you regulating that activity from the inside out, as opposed to asking somebody else to get this done. So sometimes it takes that internal switch to turn on, and that in itself is a process. And that's why you follow me, because those are the tools that I teach through my podcast, as well as the programs that I provide. Lastly, I want you to remember it's a multidisciplinary approach, okay? A multidisciplinary approach involving healthcare providers, different aspects, OB-GYNs with the physical therapist, massage therapists, and other specialists may be necessary to effectively manage and treat pelvic pain, because it's much more than just a pelvic area in and of itself. This can include addressing underlying medical conditions, providing psychological support, and tailoring the treatment plans to meet your needs. This is a time where you have to go deep into what's causing this. If you really want to get to the root of this, you really have to get to the deep cause, number one, from within you, okay? So that brings me to the conclusion today. I just want to thank you for joining us on diving deep into this world of pelvic floor health. It's a misunderstood, mismanaged topic for so long. And this episode has hopefully highlighted the importance of maintaining a strong and healthy pelvic floor. And I hope I provided the practical tips for preventing and treating these common dysfunctions. Remember, taking charge of your pelvic health is never too late, okay? So I want you to remember that. The power is in your hands. And until next time, stay healthy and happy, please. I want to thank you so much for listening to Mind Your Health podcast. And if you enjoyed this podcast, please subscribe and rate it for me. It means the world to me. As well as follow me on Instagram, TikTok, and YouTube at Dr. Connie Chung, Cheung. And this podcast is played anywhere: Spotify, Google, Amazon. We're everywhere. So wherever is convenient for you. Thank you so much, and let's bring mindfulness to our own health and be empowered to heal from within. I'll see you guys all next week.